Are my quads the cause of my knee problem? Many healthcare professionals will tell someone with knee problems that it's their quads. Their quads are weak, their quads are tight, their quads are not balanced, their quads have micro tearing, their quads are strained. But how often is it actually a quad problem? If you're an athlete and playing soccer, basketball, or rugby, then it can happen in 1.07 people. In the general population, the non-athletic population, it's even less likely to strain your quad because you don't do as many explosive type jumping movements. You can injure your quad, and I've typically seen it from a sudden fall onto the knees to give a rapid stretch to the quad muscle. So more often than not, it's not a quad problem that's causing your knee pain. But what if it actually is? How do you know when it's a quad problem causing your knee pain? So let's talk about quad strains. A strain is a pulled muscle where some micro tearing has occurred. A strain can be small where the muscle has been overstretched quickly, but not tearing has happened. No tearing has happened. This is a grade 1 strain. The tearing could be a little bit more extensive where some of the fibers are torn, but most or all of the fibers are still close enough to touch each other. This is a grade 2 strain. And finally, a grade 3 strain is a full-on tear. The muscle fibers are no longer touching and there's a complete rupture of the muscle tendon. This is a grade 3 strain or tear, requires surgery to connect those fibers again. So where is the quad muscle strain pain? The pain of a quad muscle strain will happen somewhere in the muscle belly of the quad muscle. The muscle belly is located along the front of the thigh, and there are 4 parts to the quad muscle, hence the quad name. And if you know exactly which muscle of the quad is torn, you can name it more specifically based on that part of the quad. What about a quad tendon strain? Where's that pain? The pain of a quad tendon strain will happen in the quad tendon. And the quad tendon is the end part of the muscle at the kneecap and attaching to the top part of the shin bone. The quad tendon can create pain just above the kneecap and anywhere along that midline in front of the knee to the bump at the top of the shin bone. So what type of pain will you have with a quad strain? A new strain of a muscle typically has a sharp pain when the muscle is used or stretched. The quad muscle and tendon straighten out the knee from a bent position and controls the amount of bend in a knee when you're standing and bending. So think of a squat or landing from a jump. Stretching the quad muscle and tendon involves bending the knee and extending the leg behind you. Think of standing on one leg and taking your other foot and allowing your knee to bend so your heel is touching your butt behind you. So how do I know if it's a quad problem? Well, it's likely a quad problem if you've had an injury involving the quad. You fell suddenly forward onto your knees, which gave you a quick stretch to the quad. You have pain in the quad or quad tendon when using the muscle and when stretching the muscle. The pain for a quad strain is typically sharp for a new injury, and over time, this can dull out and still be achy for a few weeks. So how do I fix a quad strain? Quad strains are best fixed with a program of progressive strengthening and stretching the muscle. This helps the muscle heal, get strong and more flexible, which then helps reduce the risk of injuring it again. Okay, to recap, it's less likely for you to get a quad strain if you're in the non-athletic population, but it still can happen. And it's more likely to happen if you have an injury where you fall onto your knees forward, giving a quick stretch to those quads. You can rehab those strains by doing progressive strengthening and stretching routine to help make the muscles stronger and more flexible. For more tips and tricks, follow along.